and welcome to my channel. My name is Jazzy RN. I've been a remote utilization review nurse for over 9 years, and the goal of my channel is to help nurses pivot from the bedside to remote work. This first company is Purpose Med, and you'll go to purposemed.com/careers, and you will scroll to see open positions. This first position is for a nurse practitioner, and it is casual, and it's remote USA. So always I first go to the requirements of the job. I do want to point out that this is an independent contractor position. It's a part-time opportunity and it's through Open Loop. The target is 15 hours per week with flexible hours and schedule. And of course, this is a location as remote USA. And the requirements are a master's degree in nursing and primary healthcare nurse practitioner diploma, active nurse practitioner license in at least 10 states, 2 years experience in primary care, experience providing virtual health care, excellent communication skills and empathetic care delivery, experience working in HIV prevention and or with the LGBTQAI+ community, daily availability for asynchronous patient care tasks that includes lab reviews, prescribing and follow-ups, plus 15 hours weekly for scheduled shifts, including live consultations. Task volume may vary based on state licensure and patient needs. And to see more about the compensation, this job pays $70 to $90 per hour. The next position I want to show you with Purpose Med is for an RN, and this is casual as well. It is remote USA. I'm going to go straight to the requirements. And for this role, you must have an active RN compact state license, 3 years experience in a clinical nursing role, clinical experience in a semi-independent practice role in medical patient care and or sexual health, experience providing virtual health care, excellent communication skills and empathetic care delivery, experience working in HIV prevention and or with the LGBTQ2IA+ community, daily availability for asynchronous patient care tasks, that's reviewing results, providing education and follow-ups, plus 20 hours weekly for scheduled shifts, including live consultations. Task volume may vary based on state licensure and patient needs. And the compensation is expected to earn approximately $50 per hour. This company is called Meraki, and they provide services for addiction recovery, adult behavioral health, autism, intellectual and developmental disability, veterans assistance, children and family, foster care, aging, and pharmacy services. Now, most of the jobs that I found on the website were all in person except for just one job. This is with LumiLink RN Weekend Remote, and it says here it's Pittsburgh, Pennsylvania as a location, and it is part-time, double shift weekends, so this means you'll work Saturday and Sunday and 7 a.m. to 7 p.m. each day. Here's the FYI, you must reside in either Ohio, Delaware, Virginia, Pennsylvania, or Texas. They want you to have a current RN compact license. They prefer you to have an IDD group home experience, which means intellectual and developmental disabilities group home experience. They want you to have call center experience, a minimum of 1 to 2 years clinical experience in acute or ambulatory care setting, and additional RN licenses as determined by LumiCare. Now, the pay is $30.01 plus $3 shift differential for weekend hours. This gives you a description of what you'll be doing on a day-to-day basis, as well as your benefits. And at the very bottom, just looks where it says about Meraki. This will give you information about the company itself. That is a nonprofit provider of developmental, behavioral health, and education services. And they have more than 8,000 employees that provide support to nearly 40,000 individuals and families throughout 12 states across the country each year. Palmetto Care is looking for a part-time obstetrics care provider. So first we go to the requirements. You must have an active compact RN license, a minimum of 4 years experience as advanced practice provider, extensive obstetric experience, including treating high-risk patients as well as some experience caring for infants, a passion for and demonstrated effectiveness in optimizing evidence-based care and perinatal outcomes, experience using data to drive patient engagement, activation, and outcomes, experience leading successful teams with track record of outstanding collaboration and teamwork, a sense of urgency to improve outcomes coupled with exceptional organization and attention to detail, a growth mindset with the ability to approach process change and ambiguous situations with enthusiasm, creativity, and accountability, facility using multiple tech platforms with an eagerness for advising about platform improvements and adapting to new systems, eager to thrive in a fast-paced, metric-driven environment, and phenomenal interpersonal and communication skills. So you must have either a nurse practitioner or a CNM, which is a certified nurse midwife with significant experience in obstetrics and some experience in infant care. And of course, you get bonus points for telehealth and our remote monitoring experience, as well as experience in outpatient or home-based management of higher risk patients. And the schedule is 2/12, that's 11 a.m. to 11 p.m. Eastern Time. You have a set schedule, which is 2 weekdays per week, and no weekends are required. MediHealth is hiring for over 105 roles. Now, as you can see here, these are contract roles for doctors. There's a clinical educator role here. I do want to mention that if your screen is a little fuzzy, I do apologize for that. For some reason, whenever I'm scrolling, it gets fuzzy, and then when I stop scrolling, the fuzziness disappears after a second or two. So the remote job that is part-time I want to show you is a part-time nurse practitioner job in the state of Washington. There's actually one I see here as well in California, but I already have the one in Washington pulled up. So first we'll go to why work with MIDI. This is a mission-driven impact role. You'll help us transform healthcare for women in midlife. This is a remote US-based role with structured hours. You work fully remote from within the United States with patient-facing hours scheduled between 7 a.m. and 7 p.m. Adjusted by patient location and licensure, this is not a digital nomad role. Work may not be performed while you are outside the United States. And the commitments are a minimum of 3 days per week required for part-time status, and that's 20 hours per week. Minimum of 2-hour block time with a maximum of 6-hour block time per workday, allowing for focused, high-quality visits. And I'm going to go to the qualifications. You must reside in the state of Washington for the duration of your employment. You must have active, unrestricted, and unencumbered nurse practitioner license in at least one U.S. state. Multiple state licenses are highly preferred. Prescriptive authority as a nurse practitioner. Active national board certification as a nurse practitioner. Minimum of 3 years recent experience practicing as a nurse practitioner in a primary care, women's health, or gynecology. Ability to work independently and make sound clinical decisions. High level of proficiency and efficiency with technology that includes telehealth, electronic medical records, communication tools. The communication tools will be, I'm assuming, Microsoft Teams or Slack. They don't say exactly what tools they use. And the electronic medical records, they don't mention which ones, but the most important or popular ones would be Epic and Cerner. Those are the top two. And a strong demonstrated passion for caring for women navigating menopause and midlife health transitions. Privia Health is hiring a care advice line RN. This one is very, very unusual because they are hiring nurses who are new nurses. So if you see the job description here, we are actively recruiting for an RN new grad intern for our remote care advice line, that's Cal RN1, to join a rapidly growing population health team. Primary role of the Cal RN1 will be to provide our patients with on-demand telephone-based care management services through a 24/7 nurse advice line. Cal RN1s will work closely with and be monitored by senior nurses to assess symptoms or concerns of callers to determine the urgency and type of care needed, refer to or schedule appointments with providers as appropriate, and give health information and advice to callers. The goal of the advice nurse advice line is to reduce unnecessary visits to the clinic and emergency department, provide information for self-care and symptom management, and to coordinate care across the healthcare delivery system. CalRN1 operate in a team-based model acting as an extension of the primary care provider. So the requirements for this job is 1 year of RN experience in adult primary care and or pediatric care in office, clinic, military, home, urgent care, or hospital setting. Associate's degree in nursing, a BSN is preferred, or willingness to obtain within 24 months. Nursing program transcript showing a passing grade in microbiology with lab, compact resident RN in good standing, and with the ability to apply to non-compact states as needed. These expenses are reimbursed. Ability to work 10 to 30 hours per week, including at least 10 hours on weekends, 3 out of 4, and every third holiday. Shifts are flexible and include 2, 4, 8, and 12-hour options. Exceptional customer service skills, strong computer and tech skills, excellent communication and listening skills, clear, confident communication and listening skills, self-motivated and self-discipline is a must, willingness to do what it takes to get the job done and make patients, parents, and providers the number one priority, ability to thrive in a quiet, secure home office environment, and detail-oriented and organized. The hourly pay for this role is $25 to $30 an hour base pay and exclusive of any bonuses or benefits. The base pay offered will be determined based on relevant factors such as experience, education, and geographic location. Also, I want to mention that I have a link in the description box below, and it's called the Cure to Bedside Burnout, and it has my list of over 70 companies I've researched that hires nurses to work remotely. This is not only just the United States, which most of these jobs are US based. Some of these companies do hire nurses to work in multiple other countries, such as Australia and the Philippines. There are many American companies that hire nurses who live in the Philippines to work for American hospitals or American insurance companies. Also, if you scroll to the very bottom or towards the bottom of this list, you will see, it's very long, you will see I have links here as well to doing your own research, either through Glassdoor or Reddit. These Reddit boards are the Remote Nurse Job Board, or these Reddit threads, Remote Nursing. Also, you can do research with Comparably, Team Blind, and Fishbowl. I also have a link here that will bring you to the course I created on how to pivot from the bedside to remote work, and it's called Remote Nursing, the Cure to Bedside Burnout. And then below that is a link to different office equipment you can purchase on Amazon to help you with your first remote role. This company is called Open Loop. Now, I went to their careers website directly through openloophealth.com/careers, and the job wasn't posted on the company website. So I'm going to scroll down so you can see exactly what I'm talking about, but it's not anywhere here. There is a MD position here. There's no nurse practitioner position here. And it looks as though most or if not all of these positions are remote. So Open may actually be a fully remote company, except for, let's see this one, they're hiring an office administrator in Peru. But other than that, majority of the positions are remote. So we're going to go to the LinkedIn page for Open Loop, and they are hiring for a functional medicine nurse practitioner. So this position is remote. Open Loop is seeking a skilled functional medicine nurse practitioner to join our team. If you are passionate about practicing and providing patient-centric functional medicine, this position is for you. We're going to go straight to the requirements, and they require you to have a master's degree, a postmaster's certificate or doctorate in nursing, current national certification in family practice through ANCC, AANP, or another nationally recognized certification, must possess active state licenses in a minimum of 2 of the following states. That includes Texas, Michigan, Colorado, Pennsylvania, Nevada, Ohio, Georgia, North Carolina, Tennessee, or Washington. That must be two of one of these states. Must possess an unrestricted DEA license, experience with hormone replacement therapy, and demonstrate competence in creating individualized treatment plans. 3 years of experience as a nurse practitioner in family practice or primary care, which is preferred, or urgent care. Excellent communication and interpersonal skills, outstanding clinical expertise, evidence-based practice, competent in providing patient education at every visit, strong verbal and written communication skills, and timely and professional. This is a 1099 contract role, which means it's pay per consult model, and the hours of operation is 7 a.m. to 7 p.m. Central Standard Time. That's Monday through Friday. Company is International SOS. I'm going to read a little bit about this company. The International SOS group of companies has been in business of saving lives for over 40 years, protecting global workforces from health and security threats. We deliver customized health, security, risk management, and well-being solutions to fuel our clients' growth and productivity. In the event of extreme weather, an epidemic, or a security incident, we provide an immediate response, providing peace of mind. Our innovative technology and medical expertise, with a focus on prevention, offers real-time, actionable insights and unparalleled on-the-ground delivery. We help clients meet compliance reporting needs for good governance. By partnering with us, organizations can fulfill their duty of care responsibilities while empowering business resilience, continuity, and sustainability. So as you can see, this company, International SOS, is worldwide. They have 76 offices, 42 clinics, 29 assistance centers, 8 regional security centers, and 17 response centers. So we're going to focus on the job. So whenever you look at the job opportunities on the website, just click on this little box to the very left and type in nurse, and you're going to click on go to search. And so far there are 69 open jobs that are for nurses. On the left hand side you'll see the jobs titles and which country. So this is actually in Germany, Czech Republic, US, Germany, etc. So the job I want to focus on today is a part-time coordinating nurse. It is a flexible location. It is remote. If you see here, it says the job title is part-time coordinating nurse. Location is anywhere in Asia. And right here it says expatriate nurses located in Asia are very welcome to apply. And we want to focus on the responsibilities of the job. The requirements of the job. So when we go to the candidate profile, you must be registered to practice in the country of origin, such as Australia, UK, or US. This is considered a plus. Western trained with at least 5 years experience in accident and emergency, intensive care, or flight nursing, excellent written and oral English language, and strong online communication skills. They also give you information about why joining International SOS, as well as if you are interested in any position, you can contact this person, Michaela Santos, michaela.santos@internationalsos.com. And they have this very nice little note here that says, please note that although International SOS is most grateful for your interest in working for us, only those candidates being considered for position will receive a response back accordingly. City of Hope is hiring a PRN, remote RN, as a patient navigator. So first we'll go over the pay. It's $34.17 to $56.29 per hour. The job type is per diem. Location is United States because this is a remote job. First I want to go over this one important detail. You must be able to work 1 day per week. That's an 8-hour shift between Monday through Friday, between 7 a.m. to 7 p.m. Pacific Standard Time. Now the requirements. Graduate of an accredited school of nursing, state-issued RN license, successful completion and verification of the California State RN license within 90 days of employment, BLS, and oncology certified nurse is highly preferred. City of Hope is an equal opportunity employer. If you want to look at the benefits, you can go here. And if you scroll towards the top of the page, you can see a list of all the job duties, and it's quite long, basically a paragraph per bullet point. And this is with City of Hope. CVS Health is hiring for multiple positions. So this first one is a Minute Clinic virtual care provider. This is PRN, and it's for 3 different locations: Arizona, California, and Illinois. So first we're going to go straight to the requirements of the job. Before I get there, I want to show this one thing here. This is a fully remote PRN position. Provider must be able to work a minimum of 9 hours per week, including every third Saturday and Sunday. Qualified candidates must hold a current FNP license in Arizona, California, or Illinois to meet minimum qualifications for this position. If hired, the position must be willing to be able to obtain additional state licensure. So back to the requirements. Candidates must be currently licensed in one of the following states to be considered, and that is Arizona, California, or Illinois. A minimum of 2 years of medically relevant experience or equivalent, effective verbal, written, and electronic communication skills, outstanding organizational skills and ability to multitask, initiative, problem-solving ability, adaptability, and flexibility, ability to work without direct supervision and practice autonomously, is proficient with information management and technology, capacity to collaborate with professional colleagues as necessary to provide quality care, and depending on the market, the ability to be proficient in both speaking and writing in additional languages, not limited to, but including Spanish may be required. And education level does require you to have a master's degree, level family nurse practitioner program with current national board certification, and state of employment license to practice in an advanced practice nurse role is required. And the pay is from $41.85 to $99.14. And then the second position is Minute Clinic virtual care nurse practitioner. This one is also PRN, and you work remotely from home in the state of Tennessee. And this one's the same exact requirements as the previous one. It's per diem requirement. Must be able to provide a minimum of 9 hours of availability per week. And down to the requirements again. And these are the exact same requirements as the previous job. Optum. Now, first I'm going to show you the LinkedIn part of the job, and then I'm going to bring you to the job itself. Now, as you can see here on LinkedIn, it says this is an RN per diem position. This was posted 7 hours ago, and 0 people have clicked apply. Now, even if you're not using LinkedIn to look for jobs, I still like to go to LinkedIn to see how many people have applied. Now, this will only show you the people who actually clicked apply and then responded to the little notification on LinkedIn that said they clicked apply, that they actually applied to the job. If someone's applying to this job directly on Optum's website, will actually not even coming to LinkedIn, you won't see how many people who actually clicked apply. But I just still like to come here to see what the competition would look like regarding applying for this job or any job on LinkedIn. So this one had 0 people who clicked apply, and this was posted 7 hours ago. The job is based in Jefferson, Indiana, and right here it says hybrid. I'm not sure why it says hybrid. Whenever I filter out jobs on LinkedIn, I make sure I also always filter for remote. If you scroll down, you will see here, you will enjoy the flexibility to work remotely from anywhere within the U.S. as you take on some tough challenges. So maybe whoever it was saw this job and decided not to apply because they don't want hybrid, they want remote. So just an FYI, if you see any jobs that say that is actually filtered out as as remote, and then you look at the job and it says hybrid, make sure you read a little bit more into the description. Maybe whoever it was who posted the job on LinkedIn chose the wrong option. Maybe he or she chose hybrid instead of clicking on remote. Because here it says this job is fully remote anywhere within the U.S. So let's say if you go to Optum, their website, you'll see Optum is also a part of United Healthcare and United Health Group. So what I did was go to their website, and I made sure I click on Explore Remote Jobs. So as you can see here, Whenever you click on Explore Remote Jobs, you're going to also type in nurse for the job title or category or skills. Next page. And this is the job I'm going over today. This is an RN per diem position in Jeffersonville, Indiana. I'm going to scroll to the requirements for the job. So you must have a current and unrestricted RN license in the state of practice, a current driver's license, vehicle insurance, and access to dependable vehicle or public transportation, a current CPR, and ability to function in any home situation regardless of age, race, creed, color, sex, disability, or financial condition of the client. Now, I'm not sure whether they're asking for all this information because you're working remotely from anywhere in the country. I've worked remotely as a utilization review nurse for over 9 years. None of the companies require any information about a CPR or a driver's license. They just check your background and they check to make sure you have a unrestricted license as an RN, and if you live in a compact state, you have a compact license. So these two bullet points, I have no idea whether they're asking for this. Also right here, they have preferred qualifications, which is 1 year of RN experience, which is very nice. Most companies require 2, 3, and sometimes even 5 years experience at the bedside. The ability to work independently and good communication, writing, and organizational skills. And this star point right here, all employees working remotely will be required to adhere to United Health Group's telecommuter policy. Ascension, and I want to give you a little background of the research I did on this company. Now, I found the job on LinkedIn, but I didn't find the job posting on the the website, the company website. So here's the website, it's jobs.ascension.org/us/en/remote. And whenever you do access the website, you want to click on remote. So basically right here where it says locations, just click remote and you'll see all the remote jobs for this company. And here are all the states that Ascension operates out of. So you'll be working as a utilization review nurse. This is part-time. Now just an FYI, because I found this on LinkedIn and not the internal or the company website, this works in your favor because if the internal employees don't see this job posting, that means that they're not applying for it internally. They're not getting notifications as an internal employee. So if it's only posted on LinkedIn or Indeed, you can see how many people are actually applying to this job. So this job was posted 21 hours ago and only 11 people clicked apply. So this works in your favor if this happens, where it's on LinkedIn but it's not on the company website. So they're not focusing on hiring, looks like internally, they're focusing on hiring externally. So this can work in your favor. So this is a part-time position. It states as it's Nashville, Tennessee, and this is department is case management. It is part-time days. The hospital is Ascension St. Thomas. Location is remote. Salary is $37.77 to $53.32. And I'd like to go straight to the qualifications. Now, I am very well versed in utilization review on the insurance side, but not on the hospital side. So for the qualification and requirements, it must be a licensed RN credential from the Tennessee Board of Nursing or current home state license for multi-state license recognition, compact state, obtained prior to hire date or job transfer date. Required education is diploma, do not require a bachelor's degree, a diploma from an accredited school or college of nursing, or require professional licensure at time of hire. That's perfect. Now, as I mentioned, I don't have utilization review experience on the hospital side, only on the insurance side. So I'm going to go over a little bit of the job description with you. And so for this job, they want you to review admissions and service requests. Now, admissions is whenever a patient admits to the hospital and he or she is admitted as an inpatient. And that can be acute level of care, intermediate level of care, and critical level of care, as well as observation level of care. And observation is when the patient is admitted for just to be observed for 48 hours or less. And this is a service request within an assigned unit for prospective, concurrent, and retrospective medical necessity and our compliance with reimbursement policy criteria. Now, whenever you, as an insurance nurse, we review for medical necessity. So I want to give you an example. Let's say a patient is admitted to the hospital for bowel obstruction. The CT scan does confirm he or she has a bowel obstruction. So on the insurance side, we review for medical necessity using the diagnosis of bowel obstruction. I'm going to use Interqual as an example. In order for me as the insurance utilization review nurse to approve this patient's authorization, the CT scan must say the patient is positive for bowel obstruction. The patient must also be NPO with an NG tube to suction and IV fluids. Now, if all that criteria or those standards are all met, then I can approve authorization. If not, if one thing is missing, so let's say that the patient or member has all the required criteria except for maybe he or she decided to refuse the NG tube. So there's no NG tube to suction. That means I'm going to send this authorization to the doctor, and the doctor makes a decision to whether approve or deny the authorization. I have no control over what the doctor does or the doctor's determination. That's up to the doctor. So basically, the hospital utilization review nurse does the same thing. He or she will review for medical necessity, provide case management and our consultation for complex cases. So, for example, this could be, let's say, a patient needs to go home, but he or she doesn't have a home. Let's say he or she is homeless. So you would actually, as the insurance nurse, or as well as the hospital nurse, utilization review nurse, you refer that patient to case management. That way, the case management team can find a local, let's say, shelter for the patient to be discharged home to. That can be and also there's also complex cases right here where, let's say, the patient can't go home because, let's say, he or she needs to have extended IV antibiotics. So let's say they decide we'll send a patient to a skilled nursing facility. Or let's say the patient also not only needs IV antibiotics but needs extensive wound care and wound dressing and so on and so forth. Then maybe the patient may go to a long-term acute care facility. Or let's say the patient is stable but is on a ventilator. They can't go home, so they'll send the patient to a long-term acute care. That's considered a complex case. This next bullet point assists departmental staff with issues related to coding, medical records documentation, pre-certification, reimbursement, and claim denials and appeals. Now, I can definitely speak for the claim denials and appeals. Let's say as the hospital nurse for this position, the insurance company decided to not deny the authorization. So that means this nurse would go through the process of getting a peer-to-peer done where the doctor with the hospital and the doctor with the patient's insurance company have a peer-to-peer, and they actually negotiate on trying to get this authorization approved. So the doctor with the hospital is trying to convince the doctor with the insurance company to approve this patient's admission. That's for the denials, and that's also called peer-to-peer. The appeals part of this bullet point is, let's say once the peer-to-peer goes south and the doctor with the insurance company still says, no, I don't want to approve this authorization, the last step is the appeals part. Now, regarding the coding and medical records and documentation, the coding would basically be regarding maybe the ICD-10 coding. I'm guessing that's what we use to basically label each diagnosis. So let's say for hypertension, that ICD-10 code is I-10. Medical records is making sure that, and documentation is making sure that the insurance company receives information to make a decision on the patient's inpatient stay, whether to approve or deny. The hospital doesn't want to drop the ball, and they shouldn't be dropping the ball by not sending clinicals. That's the easiest thing for them to do. Whenever they notify the insurance company saying, hey, your member, our patient is admitted here, and we're going to send you clinicals, or you request clinicals so that we can get this patient's inpatient stay approved and authorized. access and coordinates discharge planning needs with healthcare team members. So that's regarding, let's say the patient is to be discharged home. Will the patient be able to, is stable enough to go home and just take care of him or herself? Or does the patient need to go skilled nursing facility? Or does the patient need home health care? Does the patient need inpatient rehabilitation or long-term acute care? Or sometimes the patient isn't able to go home, and let's say the hospital that he or she is in doesn't have all the needs the patient may need, the care the patient may need, and the hospital has to transfer this patient to a different hospital because the patient needs a higher level of care. The next bullet point is may prepare statistical analysis and utilization review reports as necessary. Sounds like something that's done mostly in the hospital utilization review process. Regarding all this analysis, we don't do any of that. We just review authorizations on the insurance side and then approve them. And if the nurse, myself, cannot approve, then we send to the MD, and the MD makes a decision there. And this last bullet point is oversee and coordinate compliance to federally mandated and third-party payer utilization management rules and regulations. That basically means that whenever these patients are coming into the hospital and being admitted, you're making sure that the mandated requirements are being followed. So if the patient is Medicare, if they're Medicaid, if he or she has their own commercial private insurance, let's say through Blue Cross Blue Shield or Aetna, or let's say sometimes if the patient comes in and he or she is, let's say, under care of the local sheriff's department, then the insurance company wouldn't cover that because the patient is being admitted and they're actually in custody of the police department. That'd be the police department's jurisdiction on the payment. This company is called Geisinger. I think I'm saying that correctly. Now, just an FYI, for some reason I found the job, this PRN or part-time job on LinkedIn, but it wasn't on the company's website, which is a benefit for you because they're not actively hiring for internal employees. That's actually a benefit for you as an external employee. So a little bit about Geisinger. It's among the nation's leading providers of value-based care, serving 1.2 million people in urban and rural communities across Pennsylvania. It was founded by Abigail Geisinger. The nonprofit system generates $10 billion in annual revenues across 126 care sites. That's 10 hospital campuses and the Geisinger Health Plan with more than 500,000 members in commercial and government plans. So whenever you go to the website, you just click on nursing and support and you'll see this. And what you also want to click on, let me get rid of this. You want to click on work from home and yes. So there are 5 positions I found that are work from home. I was looking for a nurse case manager that's part-time. So I clicked on this one, and this one, it is full-time, and I don't want that one. And this LPN one, I believe this one is also full-time. I don't want that one as well. So I'm going to go to the LinkedIn site, and here it is. It's an RN case manager. It's per diem. Just an FYI, I don't have any case management experience. I had one episode for one member. I had to be a case manager for her. And the reason was, for some reason, she didn't want to talk to her case manager. So me, as a utilization review nurse for the insurance company, I just decided to just some kind of way get involved. And it was a lot of phone calls back and forth. When you work utilization review for insurance companies, you do not make a lot of phone calls and you don't receive a lot of phone calls. Maybe 3 at the most per day. I do make phone calls requesting clinicals or requesting a discharge date, but as for needing to make those phone calls, I don't have to. Just sending a fax is fine. But I get more information by calling someone and reaching someone instead of actually just sending these faxes and they go to who knows where. So this is the RN position. It's for case manager, and it is per diem, and it says it's part-time here. And I'm going to scroll down some more. Now this role is per diem, and the hours are typically between 8 a.m. and 4:30 p.m. Then once you have at least 3 years of prior RN experience is required, And that's pediatric and or obstetrics experience is preferred. And that's at the bedside. Then once you have education, specially trained program nursing required, and they prefer you to have a bachelor's degree in nursing. They want you to have your RN license in Pennsylvania, as well as basic life support certification. Now, as an insurance nurse, I've never had a company, well, an insurance company require me to have basic life support. You're working from home. You're not touching any patients. I haven't touched a patient in over 9 years. So I'm not sure why they want you to have basic life support, but that's one of their requirements. And that's it about their requirements. It's very minimal. And they also provide a little bit of information about the job itself. I don't have experience with working as a case manager, just that one time for that one member. And it was a lot of back and forth, a lot of phone calls, calling the patient, her calling me back, leaving messages. But as a utilization review nurse, just FYI, you never, ever have to speak to any patients. You're just, the only people you're speaking to is either, let's say, DataVan's an AI assist line that some hospitals have, where you can call to get a discharge date. You also will call, let's say, the utilization review department or case management department of the hospital to get either a discharge date or, let's say, additional clinicals, or let's say information about, let's say the plan is for the patient to go to, instead of going home, they're going to a skilled nursing facility, they're going to inpatient acute care, inpatient acute rehabilitation, or long-term acute care. But as for speaking to anyone, any patient or any patient family members, utilization review does not do any of that. So this is case management, and you'll be doing case management work. This company is Classet, and they're hiring for a remote care coordinator LPN. Now, on their LinkedIn profile, about the company on LinkedIn, it says Classet automates the most time-consuming recruiting tasks with voice AI. Our view is that recruiters provide the highest level of impact to candidates when they spend their time building relationships and helping candidates succeed. Transform your hiring with Classet's AI-powered instant interview solution. Automate screenings, schedule effortlessly, and hire top talent faster than ever. Experience the future of recruitment now. So this position is for a remote LPN, and it is full-time, and the location is remote work from anywhere. The pay range is $21 to $24 per hour, and this is Monday through Friday. There's no weekend work. So if you're working $21 to $24 per hour, that money would go very far if you were, let's say staying somewhere in Central or South America, or maybe even Thailand or Vietnam. Now, the requirements for this job is to have an active and unencumbered LPN, LVN license, current BLS certification. If you're working remotely, I have no idea why a basic life support certification is needed, but they require that. Also, high proficiency in EHR systems. Now, it's electronic health records. So, for example, that's Epic, Cerner, Meditech, Protouch, etc. Make sure you do list the electronic health records or electronic medical record systems you are familiar with on your job, on your resume or application whenever you fill it out online. Experience in the clinical or chronic care management, that's CCM care, coordination setting, strong communication, problem solving, and clinical reasoning skills. Proficiency in Google Suite. So make sure you put Google Suite as a part of the platforms you are familiar with. That's very similar to Microsoft Office. Ability to work independently in a HIPAA-compliant home office environment. That basically means you just have a room that you can work with a door that locks. Excellent verbal and written communication skills. And here are the nice to haves: prior experience in care coordination, chronic care management, or remote patient monitoring, familiarity with community resource navigation, experience in patient and family education for chronic conditions, knowledge of quality measures, CMS compliance or reporting, strong team-oriented mindset in a remote work environment. Home office requirements include a HIPAA-compliant workspace. That you want you to make sure it's distraction free and a private area. That means you're in a room by yourself with a door that does lock. They want you to have reliable high-speed internet connection and a dual monitor setup. And it is provided or approved by CCS. So I'm not sure if it's going to be provided by them or it must be approved by them. But just in case they want you to provide your own additional monitors, if you go to the description box below, where I have my list of over 70 companies that hires nurses to work remotely. Most of these are insurance nurses. I'm sorry, most of these are nurses for the United States, but some of these companies do hire nurses for the Philippines, Mexico, Colombia, Panama, Argentina, Costa Rica, Australia, etc. Just an FYI, if you want to do a background check on or do your own research on ClassSet, here are some options you can use: Glassdoor, Reddit, and these are some Reddit threads you can use: the Remote Nurse Job Board and Remote Nursing, as well as Comparably, Team Blind, and Fishbowl. And I have a link here for the course I created on the cure to bedside burnout. And this is on Udemy. And here, if you were to go to this link for Office Upgrade, I have a list of Office essentials that will help you with your remote working. And this is something I actually have at home that I actually use. And this is a portable monitor here. Now, this one I actually purchased years ago for $300 and something, but they're cheaper now. But it's not only allows you to work away from home, but let's say if you are, let's say, having to evacuate due to a fire or a hurricane coming your way or flooding, this is the perfect item to have for those evacuations. Or let's say you're just going to be working away from home because maybe you're between homes, let's say selling your previous home or just visiting family elsewhere. That way you can use your computer with additional monitors and still work remotely. This is a good option for you. Now, if you want something that's a little bit more cost effective, this USB-C to HDMI cable, this allows you to plug in your laptop here to the TV with this one. And actually use your TV as a secondary screen. Now, you could purchase two of these if your work computer has two USB-C ports. That is an option. But just an FYI, one of those USB-C ports are used to charge your computer. So which is why it's a good idea to have maybe a splitter to where you can use additional cords. But this is always an option if you don't want to get the portable monitors, which are pretty pricey. You can just get this cord, which is less than $10, either at Amazon or either Best Buy, or you can also go to maybe Office Max, Office Depot, and get a USB-C to HDMI cable to convert your TV to a computer screen. But back to the job. So you must, they also want you to have a dual monitor setup, and it's either provided or if you have your own, it must be approved by CCS. And here are your benefits, which also include no weekend work. This is MUSC, Medical University of South Carolina, and they're looking for a virtual PRN advanced practice provider. MUSC Health Department of Emergency Medicine, Telehealth, and it's based in Florence, South Carolina. Now it says virtual PRN, advanced practice provider, but then right here it says part-time. So we'll see as we go more into the job description. This is remote, based in South Carolina, and they're looking for advanced practice providers. That's APP for short. So it says worker subtype is PRN. The hourly rate. It is scheduled weekly hours of 4 and hours per week, 39 hours per month. So your scheduled work hours or shift is minimum of 39 hours per month. And that is a 5-hour and 10-hour shifts. Population focus will be emergency department, virtual provider in triage, and your population age range will be birth to death. Now we'll go through requirements. You must be either a physician assistant, an advanced practice RN, family nurse practitioner, and then we should also have current ER nurse practitioner certification, a minimum experience, that's 3 years experience as an APP in emergency medicine, and experience in telehealth. Now, I see they have here basic life support and advanced cardiovascular life support. For some reason, I see this with positions for remote hospital jobs. I've never seen basic life support or advanced cardiovascular life support for an insurance job as a remote nurse. So this must be some kind of requirement whenever you work for a hospital but work remotely. But you never use this. As a remote insurance nurse, I've never seen any insurance company require you to have any sort of life support, whether it be basic or advanced. They also want you to have DHEC and DEA, and your job duties says to provide direct care to patients through the following activities, and this is virtually assess all ED lobby patients. So if you've ever been to the ED or worked in the ED, you know what that is. And that's about it for the requirements. And they have physical requirements here, but you're working remotely. I'm not sure why they have you frequently lifting, lowering, push, or pull, and or carry objects weighing 50 pounds more or less unassisted. You're working remotely, so you're not actually carrying anything. And if you want more information about the job regarding your E-Verify program, you can click here to verify